Let's take a closer look at the latest coronavirus data from around the country with our analyst Casey Briggs. Casey, the nation's focus is on Victoria. Let's start there.
That's right, Kirsten, obviously for obvious reason, and we've got another 400 or so cases today, 471 of them, and we're still seeing this rapid sort of variation, more than you might expect to see that if it were just random chance, this roller coaster of case numbers with, in fact, with today's numbers actually a trend that's starting to come down, but we've seen the trend has come down a little bit and then jumped up again. So we're a bit cautious about saying anything too much, but you know, we are expecting, anticipating that this curve will more dramatically come down. It is sort of slowing but not bending at this point. It should do so once we see the effective stage 4 restrictions. A lot of questions about why we are seeing such dramatic fluctuations. It does look like more than you'd expect from just sort of random variation from day to day, and I noticed that Professor Tony Blakely, an epidemiologist, has suggested in Melbourne, has suggested that there's maybe some amount of batching of tests being done where certain test results are coming back all in clumps, or certain tests are being prioritised, and that may be why we're seeing such a big sort of variation from day to day, notwithstanding the fact that the trend does look like maybe it's beginning to sort of slowly start to turn around and bend. But we won't see really positive results, and we won't be really happy until we also see these community transmission numbers, mystery cases, the cases where no source of infection has been found. They need to come down as well, because as long as this virus is out there in the community and spreading in the community, more outbreaks, more clusters, and more vulnerable populations can get infected. And we're still seeing more than 100 investigations closed a day at the moment where no source of infection has been found. So we're watching for these to come down. The sort of night curfews and stage 4 restrictions on who can leave houses and when they can leave houses should have an impact on that. At least that is the hope. And we're yet to get any update on regional Victoria for today. We're still waiting on the full details, but that is another place that we're watching very closely to see if these numbers will start to come down. Obviously, most of regional Victoria is now just entering stage 3 restrictions. Hopefully that has an effect on this curve.
Why don't we go to New South Wales, which recorded another dozen cases today? What are the implications of the ongoing diagnoses in New South Wales?
Yeah, the overall picture in New South Wales isn't changing much, although today is the biggest number that we've seen in terms of locally acquired infections in a little while, in really since the start of the week or the weekend. 12 cases, all of them are locally acquired. 2 of them are under investigation with a mystery source, and there's been a list of exposure sites released for both of those cases, one in the Newcastle region north of Sydney, where there's been a series of venues where people should be on alert for symptoms, and one in inner Sydney and the inner west of Sydney, where we've got one restaurant in Glebe that has anyone that was there at that time is now considered a close contact and should self-isolate, and then a whole series of other venues, including a handful of pubs, a restaurant and a supermarket where the virus has potentially been as well. And that's, I guess, the big worry here. If a mystery case is cropping up in Sydney, the centre of Sydney and the inner west of Sydney, where there haven't really been many cases lately, that could be a concern. We haven't had many unknown source transmissions in the last few days. I think today's are the first ones we've seen in about 3 days. That could be some concern, but overall the picture is still pretty flat, and New South Wales really in much the same position it has been for the last 2 weeks.
Okay, Casey Briggs, thank you.